hi Snigdha.
Hello, doctor.
So it's always been great talking to you. Uh, I think the three things which you mentioned, they are the most important. And first thing which I want to highlight is that you very rightly mentioned that how the diagnosis of multiple sclerosis was disclosed to you. So it's very pertinent, and I think the global MS community now understands that there is no need to rush and discuss the treatment options on the day one of disclosure of the multiple sclerosis, because it's going to be a long journey together. And so first and foremost, the way you let yourself get absorb the news of I would say the multiple sclerosis coming in your way, and the way you fought it, I think that's the way how most of the people who are diagnosed with multiple sclerosis should be looking at. And we as neurologists, as people who focus on multiple sclerosis, should be understanding that it should not be an abrupt disclosure. And obviously we have to maintain the honesty that it's going to be a long journey, and the need for early treatment, and definitely opting for treatment. But obviously even discussing that treatment paradigm would be should go on the next visit. The first visit should be disclosing the diagnosis. Both the person should be able to first absorb the news, and then we should be mutually agreeing to a treatment plan. So I think it's a plan which has to be made. Very rightly mentioned that there is once you have agreed on a treatment plan mutually, the best thing is to follow that plan. So it's more than obedience. I think it's being focusing and collectively and following the same plan, looking for any factors which can which will lead to rethink, revisit, and I think reinitiate the discussion. That is the most important. The third very important aspect you told is that it's a fight. Obviously you have people around to help you around also, and people who will be maybe not understanding your problems and discouraging you to at some point. But so it's a fight not only against the disease, about your with people around you. And so along with the doctors, I think the role of family, the role of friends, the role of your peer, your role of colleagues, because obviously it affects people in the productive age group. So I would say colleagues, peer and friends, they matter a lot, and give them the mental attitude, aptitude, and the courage to give the fight. And we can't overemphasize the role of exercise, which you have actually, and I am witnessing it, being your treating doctor for the last now 5 years, more than 5. So that how the same disease level will affect someone who's not exercising and someone who's putting in regular exercise. I think the fitness, physical fitness, gives you the not only the endurance physically, but the mental endurance. So if you can elaborate on your ways to cope up, I would say physically as well as mentally, that would be quite insightful for our people with MS, and that would be a great message.
Sure. As you asked, doctor, that coping up, this would MS itself is a snowflake disease. You can't say this is one for this person, this is like this, so for 4 others it will be like, we can't say that. And coping up, again, it completely depends on an individual. First we need to grasp it, that okay, it's there, now what's next, how to face it. My coping up was, I got into exercising. And when I say exercising, again, like I said, it's about your passion, what you want to do. You want to write something, get diverted there, that's how I do it. You want to cook, or I mean, I'm just citing example. You want to do some social activity, get focus there. As in, the less you try to focus on your own challenges, that will help you getting distracted and not focusing on the challenges that you face. Because like I say, things we can't do much about, there is no point zooming into that. And when we shift our horizon, we make a bigger horizon, then our thought pattern gets elaborated, and yes, difficulties will be there, but then my challenges focus would be diversified. And that's what I did workout. And when I say workout, I didn't do, though it is advised to do stretches and the basic pilates and all, but I tried challenging myself. That was my coping up. I challenged myself, I did weight. And since my lower limb, I am not very good with my lower limb, but my upper limb is good, so I focus there. And when I exhausted, I'm not saying completely exhausting, but when I worked out, I came home, got tired, and but yeah, to tell you, there has to be a thin line. Don't over exhaust, whatever you do, mentally or physically. Draw a thin line. I came home, I rested, and I got a good night's sleep also. I didn't find struggle in sleeping. Next morning I wake up and I could put my feet down from the bed. I say, okay, thank God, this day is set. Challenges everybody has, like even a person doesn't have MS has challenges. We have our difficult, peculiar kind of challenge, so that's okay. But we coping up, again, like doctor, you asked me, I can't narrow it down, this is how we cope up. We got to choose how you cope up, how I cope up, how the other person copes up. It's a very individualistic choice. And but once you get that, then there's nothing that could stop you. Yes, there will be challenges, there will be difficult phases, there will be days wherein you're lacking in confidence. It's okay. It happens, a part of MS. I think normal people also face that. So
yeah, that's the heterogeneity of the multiple sclerosis, that not every patient labeled with multiple sclerosis is the same. So we have to cater, we have to tailor made the therapies. And obviously very finely said that fatigue being a very important feature, and you should not definitely be overdoing, but definitely indulging in one or the other physical activity. And another thing which she actually mentioned is very important. We always talk about ambulation, walking in multiple sclerosis. That's not the end. We have a lot of people who, and she did mention the upper limb dexterity and the strength, which is important, because that is something which can actually, it's equally important. Even people who have either due to absence of treatment or ineffectiveness of or unsuccessful treatments, they land up with wheelchair or with the inability to ambulate. So or they are not able to ambulate, they can still have good quality of life if they have good upper limb function. And that's not the end. So even sometimes people say that we have lost the ambulation or the ambulatory function, we should stop our DMTs. How will it help? They forget that upper limb function is still there to be preserved. And then there is the brain health, their cognition. So you can't go away with these two important strengths. So because these are gonna give you a good quality of life still, and you have to preserve them. So preserving the neurological reserve, preserving the functionality, I think that's the most important and poorly understood aspect of disease modifying therapies. That is, and target of the treatments should be very, very clearly understood at the beginning. You can't expect a symptom improvement with disease modifying therapy. For that, you might require either some physiotherapy or occupational therapy or certain disease symptom specific treatments. But the purpose of disease modifying therapies is definitely that you don't get another attack, you don't have another silent activity which can be only picked up by the MRIs, or you don't show any signs of progression of disability, which is actually only evaluated on regular follow-ups with your neurologist. So I think on behalf of People for People with MS Foundation and my current area of practice, Artemis Hospital, and being a MS neurologist, I would like to emphasize that the aspects where Snigdha has actually put all those things in perspective, I think those should be really understood well, followed, and be there with your neurologist, discuss and make out a plan and just stick to it. That's the key message.
Yeah.
Thank you.
Thank you.